Ladies and gentlemen, I'm very honored to be part of the LabMed Forum this year again. I will present on our current attempts on digitalization in cardiac surgery at the German Heart Center Munich. During my talk, I will give you a short overview about 4 projects describing the current limitations and how we try to solve these by using artificial intelligence, deep learning technology, and robotic systems. This slide gives you an overview of all major projects and networks which have been established at the German Heart Center Munich during the last years. I will focus only on the large network Digitale OP, which has been funded by the government of Bavaria. The first project I would like to share with you is the Digital Intensive Care Suite. Beside others, the current problem at the ICU are a rapidly increasing data, still a large amount of written medical records, and no automated documentation of physical activity of patients and of actions of medical staff. To overcome these limitations, we are working on online data acquisition, intelligent storage platforms, and novel visualization tools by using innovative interfaces and algorithms. For visual documentation of patient and medical staff, we are developing new camera sensoric-based tools to detect and document specific actions, as you can see in this movie. Another project I would like to share with you is the use of new imaging algorithms for preoperative procedure planning. Here is an example of aortic valve reconstruction using autologous pericardium. In this operation, you have to harvest a piece of pericardium to create new leaflets. The problem is that sizing and preparation of leaflets is only possible during cardiac arrest after explantation of the native valve. Together with LaraLab and MEDICA from TUM, we developed a new CT segmentation algorithm which has implemented artificial sizing tools. These artificial sizing tools allow a very precise preoperative measurement of needed leaflets. This technology could also be used in different cardiac surgical procedures like minimal invasive mitral valve surgery to predict ring sizes, etc. Next, I would like to share with you our project on the development of a robotic system for transcatheter aortic valve implantation. The problem of TAVR implantation is the use of fluoroscopy. The catheter movement and valve implantation relies mainly on surgeon's experience and eyeballing. Another problem is that the catheter movement with no touch technique to the arterial wall is impossible in case of severe kinking of the vessels, as you can imagine from these images. Together with EndoSearch and MEDICA from TUM, we are developing a new algorithm for fast automated segmentation of blood vessels, as you can see in this movie. This could be used to plan the pathway for catheter movement into the final position. This visualization tool is connected to a tracking device for wires and catheters and allows precise navigation with a prior reconstructed pathway. In the upper movie, you can see the 3D print of the previously shown vasculature system combined with the tracking device and tool for mechanical wire movement. On the lower movie, you can see this tool and the currently possible degrees of freedom for wire movement within an artery. The last, very preliminary project I would like to share with you is the development of an autonomous robotic system for large cell culture needed in cell-based cardiac regeneration approaches. The current problem in cell-based regenerative approaches is the very high number of cardiomyocytes or cardiac progenitor cells which are needed to treat an individual patient. The generation of this cell product is very time-consuming, needs a high demand on human resources, and has a very high cost of consumables. To overcome these limitations, we started a joint project together with MEDICA to develop a robotic system for large-scale cell culture which will have the advantages of a closed-door approach, a 24-hour deep learning-based cell growth supervision, a fully automatic liquid exchange, and it allows for robotic-assisted cell expansion. Thank you very much for your attention, and I'm happy to take questions.
But now coming to the second speaker, this is Professor Markus Krane. And you have showed several examples of your really fascinating examples of how digitalization is implemented in your work. At intensive care unit, where is the role of the lab there? Does digitalization play a role for you there?
Yes, thank you very much for this question. Of course, also data from the lab should be integrated in the future. At the moment, we are focusing very much on data which are online available, like blood pressure or something like that, and try to integrate the visualization tools, because this is really a novel sensoric which is implemented in monitoring of patients and staff. So, but definitely in the next round, we should think about how to implement blood measurements which you are providing with your lab. So this has to be in the future implemented.
For these preoperative planning of interventions, are there also other examples you could show where it is used?
Yes, there are a lot of examples where you can use that. During my talk, I mentioned that shortly, like minimal invasive operations, for example. If you access for example, minimal invasive reconstruction of the mitral valve, the access is just 2 to 3 centimeters. So it is very difficult in this kind of operation to get the sizer for ring sizing, ring measurement into the small access part. And for that, a preoperative planning, where you already know which kind of ring you have to implement, would be a big success and a big advantage for the surgeon to know that already.
Yeah. And then your last example, you showed that cells are cultured by a robot there. So could you explain which cells are cultivated and which volumes you get out of it? Is it helpful for you to produce these tissues that you use then later on for your surgery?
So first of all, I have to mention this is an ongoing project. There is no working existing robot at the moment. So it's not that we just have to put the cells into it and get it out of that. But we are on the way to create that. So first steps are taken on this way to have a fully automated cell culture system at the end. The number which you need to treat one patient is around 500 to 1 billion cells. And you can imagine this is a lot of stuff which you have to generate. So, for example, if you want to generate cardiac progenitor cells, you need 60 6-well plates for just one patient. And if you want to prepare that for a couple of patients, then you have a turnover in your cell culture, which is almost impossible to do if you do that manually. So this was the idea that this robotic system was born. And for that reason, we implemented a cell culture incubation system, which is triple the size of a normal incubator. So it's much larger than me. And this system is already implemented with this arm, which you have seen, which has the revolver for the microscope. And at the moment, we are working on this learning mechanism, how you can say it's a good cell culture, it's in the right condition to go on with the culture, or you have to split the culture. So these deep learning mechanisms are at the moment recorded. And we hope to have that in place in, let's say, 6 to 8 months. That's what we are planning at the moment.
Great, that's a good vision. Thank you very much.